Have you heard of cognitive behavioral therapy, or CBT? If you have an upcoming surgery, talking about someone with CBT might help your pain, your sleep, and your overall surgical experience. Let's start with pain. When we think about the pain response to a trauma or surgery, when we historically thought about it, we just thought about the actual trauma and damage that was done to your body, and thus a person had pain. But when people started to look at individuals' pain experience and how it was so different from patient to patient, they realized that there were other factors that impacted how much pain people felt. For example, things like a person's stress, anxiety, sleep, history of depression, history of pain, expectations of pain. All of those things increased how much pain people felt. And there was this other concept emerged called pain catastrophizing. Pain catastrophizing is taking an idea of pain or an experience of pain and kind of magnifying it. For example, if you're having pain after surgery, instead of just acknowledging the fact that you're having pain, catastrophizing would be thinking to yourself, I feel so terrible, I'm never going to feel better again, I'm always going to feel this way. It's an extreme example, but it's taking that experience of pain and really catastrophizing it in your mind. Something similar can be seen with sleep. If you're lying awake at night and you can't sleep, instead of just acknowledging the fact that you're having a hard time sleeping, catastrophizing it would be thinking, I'm going to be so tired tomorrow. How am I going to function? How am I going to go to work? How am I going to interact with my kids? I'm going to be so tired. When will I ever get a good night's sleep? It's taking this experience of not being able to sleep and blowing it out of proportion. That's catastrophizing. So what cognitive behavioral therapy does is it really trains your mind to take those intrusive thoughts and reframe them, restructure them. So for example, instead of lying in bed at night thinking, I'm never going to have another good night's sleep, you can acknowledge the fact that you're having a hard time sleeping and restructure that and say, I will be okay even if I can't fall asleep for a while. I will make it through the next day. For pain, it might be acknowledging the fact that, yes, I just had surgery. I expected to feel some pain after surgery. I will get over this. I will feel better. It's taking that experience, restructuring it, and bringing it back to more a realistic understanding. I'm not a psychologist. This is not my area of expertise, and that was a very simplistic explanation. But studies have shown that this can be very helpful in people dealing with pain and sleep, which are so important and critical before and after surgery. If you've had experience with this, let me know below. I would love to learn how you learned about it and what you thought.